jaundice is a very common condition in newborns, and in fact, most people think that this is just part of normal physiology, but for a small subset of infants, the jaundice becomes very significant. So they would have much more yellow skin, but more importantly, the level of bilirubin, which is what's causing jaundice, can cause them significant problems, and to the extent, even in very rare cases, of brain damage. And the reason that we screen for this problem is so that we can treat it early and so that it doesn't cause babies significant problems. We did the study for a number of reasons. The first is that jaundice is a common problem, and we know that as a healthcare system we are able to treat jaundice so that it doesn't become clinically significant. The second reason is that although we have a national guideline that suggests when infants should be screened and followed up, our healthcare system is provincial, and we know from a wealth of other studies that just because a guideline is issued doesn't mean that it's implemented. And lastly, very specifically, we had already done some work looking particularly at infants and their follow-up by physicians early after they leave the hospital, and we had already found that there were some significant social disparities in which infants were being followed. We capitalized on two different sources of data. So the first is we just had to understand which hospitals had actually implemented the bilirubin screening guidelines, and so we did a survey of all hospitals in Ontario which provide maternity care services. And then we linked that data to data that we call health administrative data, which is essentially data that the healthcare system collects in its day-to-day business of running itself. And these data are available at the Institute for Clinical Evaluative Sciences for research purposes. And so specifically we looked at low-risk babies. So these would be babies that aren't premature, don't have medical problems, so ones that go home in the first 3 days of life. And what we wanted to understand was whether or not they had had a follow-up visit within the recommended time period of 48 hours after leaving the hospital. So our key findings when we studied over 750,000 babies born in Ontario between 2003 and 2011 were that indeed follow-up visits did increase after the implementation of the guidelines, but only by about 5%. So before the guidelines, about just under 30% of infants were being seen within 48 hours, and that increased to about 35%. However, we found that all of the gains in visits were by infants of higher income families. But by the time you got to the lowest income babies, they had no change after the implementation of guidelines. Though only a very small number of infants will have severe jaundice, the problem is very treatable, and our healthcare system needs to ensure that all babies have access to appropriate follow-up care to ensure that we don't have any cases of this terrible and preventable problem. One final important implication would be that for any new healthcare programs or policies, that these be monitored with an equity lens. These equity lenses could relate to families' socioeconomic status, their level of education, where they live, whether they are newcomers to the country. So many of the important social determinants of healthcare and health literacy.